I guess the biggest question I have, because we talked about vaccines, if you're not an anti-vaxxer, which you were labeled one and you're not, I guess, do you plan on getting the vaccine?
So listen, I've had lots of vaccines in my life.
Yeah, we're all here because we had them.
And my kids have had vaccines. And I've known throughout my history that to develop a safe and effective vaccine, it takes many years. I don't believe that you can create a safe and effective vaccine in months. Okay. And so, no, I will not be taking this vaccine because the threat or the risk to me from COVID is not very high. Mm-hmm. It's not very, and if I did get it, I probably might not feel well for a few days, but I am not going to have something put into me, which is, and as we saw with today's announcements with AstraZeneca's vaccine, when you rush things, don't be surprised that you screw things up a little bit and you don't get them right. So AstraZeneca now is not to be given to people under 55 and not to be given to people over 65 in this country.
I think that's an over caution. What I think that.
Yeah, because I think 340,000 people in Canada have gotten the vaccine, the AstraZeneca vaccine, and not one issue.
20 other countries have suspended its use as well.
Yeah,
so, overcautious, I think.
Okay, call me overcautious then. Okay.
So
yeah, that's fair.
Okay, so and that's totally. But why not why not be overcautious with masking? If you're going to be overcautious and not get the vaccine, why not be overcautious and say, hey, yeah, I believe COVID exists, which you have said on this show, you believe it exists. Why can't we be overcautious in that department? Is it about freedom?
Well, there's two things I think that are important in that regard. The first one is when I look at the evidence and when I look at the studies and the data, I come to the conclusion that masks are largely ineffective and that healthy people cannot spread the virus. Okay, so that's my premise.
Okay.
So, but when somebody wears a mask, what you are telling everybody, whether you recognize this or not, you're telling everybody,
I like you. That's what they're saying. I like you, and I'm not going to make you sick.
What they're telling you is that they believe that they are a danger, that they are a vector of transmission for the virus, and that they believe that every other person is a vector of the transmission of the virus. And then, therefore, these lockdowns and these impositions on freedom are justified because we are all dangerous to one.
What does it say when you don't wear a mask, Randy?
It says that it can say a number of different things, because all our public health orders permit and allow for an exemption for various reasons. Okay, medical, psychological. There's a number of different exemptions.
Religious is one of the things too.
So
that's where we all disagree. I think all that's a little.
But I think what I think it does say to people is, you're not fearful of the virus, and that you've come to a conclusion that other people aren't dangerous either.